My name is Suzanna Byrne. I'm the Clinical Midwife Manager 3 in the Early Pregnancy and Assessment Unit. So while vaginal bleeding is not normal in early pregnancy, it can be common. And this symptom does not always mean there's something wrong, and mostly we can reassure our patients. However, it can be a sign of a miscarriage, and if you experience any vaginal bleeding in early pregnancy, please contact your GP, your midwife, your obstetrician, or your maternity hospital for advice. We will discuss this symptom with you over the phone, give advice, and organise an appointment as necessary. And if you experience pain or heavy bleeding, you should attend the emergency assessment unit in your local maternity unit. So the Early Pregnancy Assessment Service is a dedicated specialist department located on the Rotunda campus. And this unit deals with problems in early pregnancy, such as women with a positive pregnancy test experience of vaginal bleeding, women with a positive pregnancy test to have an intrauterine device such as a Mirena or a copper coil, women who have attended another scan provider and have been told that there's no fetal heartbeat or they can't see the pregnancy, so that it's pregnancy of unknown location, and women with a history of ectopic pregnancy, tubal surgery, a previous molar pregnancy, or 2 or more consecutive miscarriages, so that's 2 pregnant miscarriages that are in a row. So currently we see women dependent on their gestation. We aim to see women around 8 weeks gestation or around 7 weeks gestation if they've had a previous ectopic or molar pregnancy. And once we receive the referral, we have appointments available within 1 to 2 weeks.
How do I get seen in the early pregnancy assessment service?
Sorry. So to be seen in the early pregnancy assessment unit, you can either self-refer if you have the history of 2 or more consecutive miscarriages, a previous ectopic or a previous tubal surgery, or a molar pregnancy. Your GP can also refer you, or you can be referred from a department such as emergency assessment unit or the gynae ward within this hospital, for example. So you will receive an appointment for an assessment in the early pregnancy assessment unit within 1 to 2 weeks. And all referrals are triaged by our experienced midwifery and obstetric team, and they will organise the scan for you from the triage. Why do you have to wait? So we try and do the scans around 8 weeks gestation, and the reason we do that is that we're most likely to see the fetal heartbeat at that gestation, and the pregnancy is most likely to be in the uterus, so therefore we can offer you more reassurance. And also at that gestation, we would reduce the requirement for a transvaginal scan. And why do I have to have a repeat scan? The reason for this is we may have to provide a repeat scan if we cannot reassure you. If your pregnancy measurements don't match your expected gestation, or if the pregnancy test is still positive, but the pregnancy cannot be seen. We will then continue to monitor you by repeating the scan at another appointment and or take bloods as necessary. There are 3 main options for treating a miscarriage. The first one would be conservative management. This is the wait and see approach. With modern ultrasound, we can provide this service to women that prefer this option. Most miscarriages will occur naturally within 2 weeks, and we will provide advice of what to look for, such as signs of infection. We would arrange a return appointment around 2 weeks later to repeat the ultrasound and assess if further treatment is required. The second option would be medical management. This is the option that we use medication to start the process of miscarriage. There are 2 medications that we use, mifepristone and misoprostol. The first medication, mifepristone, is taken under supervision while in the early pregnancy unit, and the second medication, misoprostol, is given to take at home between 36 to 48 hours later. A prescription of pain relief is available, and we will advise you of what to expect, when to contact the early pregnancy unit if required. In most cases, this treatment is all that is required, and if your pregnancy test remains positive after 14 days, we will need to see you in the early pregnancy unit for a review. The third option is surgical management, and that's surgery called the evacuation of retained products of conception, ERPC, or some people would know it as a D&C. This is a surgical procedure that requires a general anaesthetic. The procedure is done vaginally and there is no incision or stitches. If you choose to require this surgical procedure, we will discuss this in detail with you of what to expect and the risks of the procedure. So the early pregnancy unit specialises in early pregnancy. It is an appointment-only service and we don't accept walk-in appointments. However, we have a very quick turnaround for appointments and the appointments are generally offered within 1 to 2 weeks of referral. The emergency and assessment unit is exactly that. It should be only accessed when absolutely necessary. So when you attend the early pregnancy assessment unit, you'll register with one of our designated administration team. They'll take your name, your date of birth, your address, all that information is really important if we have to do further tests for you. You will be seen by a sonographer who will perform your scan, a midwife and a doctor who will explain the findings of the scan, discuss treatment options as necessary. Miscarriage is shocking and traumatising and our team will also provide counselling and support. We also have extra support services such as our bereavement team who specialise in counselling and support. And we understand there's no time limit to grief, so we encourage our patients to access these services. So about 1 in 4 pregnancies end in miscarriage. It's usually difficult to give a definite answer of why this happens. So it's important that you don't blame yourself. At least 60%, maybe even as high as 80% of miscarriages occur because of a chromosomal abnormality. And only in a small number of women with recurrent miscarriages can we give a definite cause. If recurrent miscarriage occurs, we can provide services such as our recurrent miscarriage clinic where we'll assess and do tests to see if we can determine what we need to do for our next pregnancy. So we have a designated bereavement team within the hospital and we have the bereavement social worker who will give counselling. We have a specialist midwife within the bereavement service and we also have a chaplain. The early pregnancy unit team is also available. And you know, as grief hasn't got a time limit, you know, there's other agencies that are available such as the Miscarriage Association of Ireland and Ectopic Pregnancy Ireland also. So miscarriage is defined as a loss of pregnancy before the 24th week of pregnancy, but most miscarriages happen in the first 12 weeks of pregnancy. It is estimated that about 1 to 2 in 100 women will have a miscarriage in the second trimester.